It's a beautiful day, my abundant dreamers. And welcome sa isa na namang inspiring episode of Living Life in Beautiful Abundance. Of course, kasama niyo pa rin, Badith Ipanag. Today, we are joined by a leader of healthcare, a passionate advocate for medical reform, and a man on a mission to make quality healthcare accessible for all. Sino siya? Watch this. Ladies and gentlemen, let us all welcome Dr. Romulo Busuego. Doc, welcome to Living Life in Beautiful Abundance. And of course, I am so excited and so honored to have you here in my show.
Thank you.
Kamusta, aking kaibigan?
Okay lang. At the same time, salamat sa special time with you, no?
Pero Doc, alam mo, para kang pumupogi ngayon lalo.
Wala pa.
Kasi yung last na nag-usap tayo, nagkita tayo, we've been talking when it's pandemic time, right?
Oh yes, a long time ago. It's about 4 years ago, I think.
And of course, you're so passionate about your profession as a doctor.
Thank
and
you.
in fact, marami kang mga informations, no, and knowledge na shinare sa akin. And I am so touched about your passion to serve the people. Doon naman ako bilib sa'yo. Diba? Doc, let's get started. Ready ka na ba?
I'll try. Okay.
What will you try? Of course, you're born to be ready. Doc, you've worn so many hats in the medical field. Alam natin yan. Diba? From being a surgeon to a leading hospitals here in Davao. And even working at Department of Health. What inspired you to take this path?
Well, ang una, actually, my inspiration then was when I started training as a surgical resident, no? Alam mo yung aming panahon na yun, to be honest with you, I never liked to be in the field of medicine.
Okay.
My first love was flying.
Flying. So
Flying,
you want to be a
pilot.
pilot?
Yeah, oo.
Okay.
So, wala tayong realization until finally, dumating yung when I was in high school, my father inspired me to go into medicine. So, mahirap pakipaglaban sa tatay. So, I took his advice. So, I finally realized, so natapos ako sa medicine. So when I joined, when becoming a doctor, I went into a training program, which is basic, no? So I choose to be a surgeon instead of other field of specialty, no?
Okay.
Kasi siguro magaling ko sa anatomy naman So hindi ko nangungopia ng panahon na yun. so being immersed in a government setting, because I trained in the Davao Medical Center for 5 years, nakita ko lahat yung deficiencies.
Okay.
Yung mga needs ng ating mga pasyente, lalo lang yung mga karamihan ng ating pasyente dyan are vulnerable patients. Wala talaga. The poorest of the poor, no? So when I started having my training, the realization started, bakit may maraming ganitong sakit? Bakit lagi tayo hindi nauubusan ng pasyente rito sa ospital? Like, why is it that I'm always doing surgery in the evening and I'm confined in the operating room almost to wake up 2 days after, no? So, sabi ko, kaya ihinto ito. So, basically, while I was training for 4 years, doon na talagang immerse yung aking realization. But my profession is really important, which I have not appreciated when I was a student. Or perhaps when I was trying to hesitate the intention of my father. to be a doctor.
So, Doc, sabi mo nga na parang you want, first and foremost, gusto mo talaga maging piloto.
Yes.
Ngayon, nandito ka sa field ng as a doctor.
Yes.
So, paano mo na-realize or paano mo in-embrace yung pagiging doktor mo na, kumbaga, prior than that, Doc, na-realize mo na ba na gusto ko talagang maging doktor because I want to achieve something in my life, like yung nasa college ka pa or yung patapos ka pa lang sa profession mo. How do you embrace being a doctor? Paano mo in-embrace yung profession na yon? Na naisip mo ba, Doc, na I want to be a doctor because I want to have plenty of money?
No, ang sabi ko nga kanina, I only realized that when I'm the only son.
Yes.
And we had enough for ourselves,
Exactly.
no? So I never thought of any material things in the future. Being the only boy in the family, alam mo na, the only boy, spoiled masyado. So I came to realize as I said, when I started to join, I started to be a doctor now. So sabi ko nga, nakita ko yung pangangailangan
Deficiency.
sa aking, where I was training, na may pagkukulang pa talaga. Not only in terms of manpower, but marami pang kailangan that I have to discover. So, na-embrace ko yun. As basically, my vocation to go further and ask my question every day that how can I do, how can I help?
I like the word, Doc, when you say vocation. So, ibig sabihin yung pagiging doktor para sa inyo, hindi lang isang profesyon, kundi isang bokasyon. And I honor you for that.
I think all doctor must consider that because being a doctor, the profession is actually a vocation.
Yes.
And there may be some doctors, nalimutan nila yung intention na yan, no? It's a dedication that you have to spend. It's a sacrifice that you have to commit yourself to what you have promised to your patients in regards to your profession.
Same din sa promise mo, kung naging piloto ka ngayon, promise mo rin na ang pamilyang sakay mo, safe na makakarating sa kanilang mga mahal sa buhay.
Correct.
Diba? So, what has been the most defining moment in your journey as a doctor and as a leader? Alam natin na hindi ka lang isang ordinaryong doktor. You are somebody in your field.
Well, sabi ko nga, siguro, I was just given the right time, the right door to open, that the needs are there, and I was there to be available to serve, no? Ang ibig ko sabihin noon, when I was offered to be the head of office in one of the hospital owned by the government, I never asked for it, so they offered it to me. So I thought na yun, in connection with my, questions when I was a resident, sabi ko, maybe this time I can multiply more of my hands. No? Running a bigger institution, before I only was able to produce few doctors because I'm only a surgeon. Now I'm running an institution. I can produce more and more people, more and more doctors to be like me as a manager. Yan, ibig sabihin. So that was the most challenging part of my life. It was a privilege, and it was a forthcoming dream of mine in how I can really produce more doctors, competent doctors, to serve the poorest of the poor. You know, if possible, if they can do it, but at least we have more doctors around with us.
Gusto ko yung purpose na yon. Sabi mo nga, if you can just multiply your hands for the people, no? And that is something. Kumbaga, sabihin na natin, there's sacrifice in it. Alam ko yon, Doc. Tama. Kasi at your age, diba? Imaginein mo, at your age, pwede ka nang alam mo yan, pwede ka just sit sa iyong hacienda, you just travel around the world, but still, you choose to be a public servant. You choose to help the people.
I miss all my dreams. I wanted to be a thoracic surgeon. I want to be a specialist barber.
Yeah.
But when I was captured in that four walls of responsibility, nasa gobyerno ko na, yung nakikita mo na yung paghihirap ng mga ating mga pasyente, that motivated me to
And we
stick
know,
and as I said, keep up
yes.
and think of how we can offer more within my capacity as a manager.
And we know for a fact that yun yung major problem ng ating bansa, no? Health
yes,
is, we have to put priority on it. Kasi alam natin na napakalaking problema yon ng Pilipinas. Diba? And we have to address that. Doc, speaking of nasa gobyerno ka, with your many roles from CEO to DOH assistant, secretary, how do you balance leadership responsibilities while staying connected, of course, with your purpose?
Well, leadership is like equated to responsibilities.
Exactly.
No? So, being a leader, you have to demonstrate it's like a set of mindset, yan ba? Collectively rather, people to be in one direction.
Yes.
In one direction, and you can inspire them to be like you, inspire them to preserve the values of what you are there as your boss, no? But I will say I'm my boss because it's something different. You know, being a leader is like you should not develop resentment. No, it should be acceptable by all, and balancing it between the leadership and your people there is just like that. You make people happy and respond to their needs, listen to them.
Ano yung mas malaki ang, kumbaga, equation? You do more on the talking or you do more on listening?
I do it both ways, but I listen more, and when I make my rounds in the hospital, it's more than there. I go up. I don't listen to my supervisors. I double check them. Punta ako doon. I'll make rounds. And every Monday, we meet them and talk about the problems of the institution. In my mind, there's already a storage of information because I was there down. So I am more of people talking to people, their needs, their concern, that immediately be addressed.
Doc, nako'y pangutana, katong naa ka sa serbisyo sa DOH, katong nakita nimo, especially katong mga pulis, ako I've been also working with government before, no, na ang baliktad po sa to, because yung connection ko with the people is more on their benefits, diba? Ano yung makukuha nila, ano yung mga gastos nila. Ikaw, Doc, na nandun ka, you are entirely with them. How do you feel na yung mga tao na wala talagang pangpagamot, walang pangbayad, and they're not being attended properly because of this?
Some people can tell that, no, who knows me well, that sabi ko sa kanila, your priority here is your job. What was your job? Is your patient. May kasabihan ako, you can never be wrong when you think of your patient. Kahit alam mong baliktarin mo maghapon yung institution na yan, if you always consider your patients, hindi ka magkakamali. Now, yung kaya pangangailangan nila is everybody's needs. Sabi ko nga, nung panahon ko, napakahirap ang support nun. Mahirap at we source out, we did everything, no? Ginawa namin lahat na in our strength and how other influence can help us, no? Nakikisama ko sa mga politician, nakikisama ko sa mga non-governmental agencies. So we were able to put up the hospital ng hospital. At the same time, give a little additional to the fund that is very minimal before. So somehow we were able to balance the needs, but not completely was given because yun nga, pagkukulang lahat ng resources. Kaya ngayon, sabi ko nga, hanggang ngayon, sabi ko, kailan ba ito matapos yung ang paghihirap ng aking iniisip na pangangailangan ng ating mga pasyente. That's why I'm still around until now.
So you're still willing to give your service to the people. Doc, the healthcare industry has faced major challenges, alam natin yan.
Yes.
Especially in recent years, no? What has been the toughest challenge you've encountered and how did you overcome it?
being in the government setup, no, and maraming mga challenges tayong nakaharap. But you are asking me the extreme of the challenges. So I think the time, yun nga, mga challenges na ito nga, hindi ka makabigay bita ng beyond your control.
Yes.
Hindi mo na kaya eh. So, yan magiging challenge mo kasi you feel frustrated. Kaya sabi ko, until now, I'm still with doing something. I'm still working. Because I feel that may pagkukulang pa rin. Di ba? So,
Hindi naman siya madaling i-solve, Doc. Alam natin yun.
mahirap.
There's no such thing as walk in the park.
Correct.
And that is why everybody should work from it. And it should be coming from everybody, not for one person alone.
Precisely.
Diba?
Correct.
So, but the thing is, your commitment and your passion is really something to us. Because that would definitely help the people. So, what is important here, Doc, is how can we mindset the people to thrive for good? Kumbaga isipin natin ba na ano ba dapat natin gawin? Ano ba din ang maging parte sa pasyon natin bilang mamamayan? Hindi lang nanggagaling sa leader yon, kundi pati din sa atin. Tayo, ordinary citizen. Kami as ordinary citizen.
Well, sabi ko nga, lahat dapat has its own responsibilities.
Yes.
No? Kailangan alam mo ang obligasyon mo sa bawat isa. Sa mga kapatid mo, ikaw, sarili mo, may mga obligasyon tayo.
Yes.
Pero minsan, nawawala yun eh. Para nagiging dependent na tayo sa lahat dahil meron tayong kapatid, nagbibigay sa atin, meron tayong mga kamag-anak, nagbibigay sa atin. But sabi ko nga, kung meron yung mga has enough, yung merong tamang-tama lang, siguro they can emulate by helping them, guide them, inspire them, that they have to work in order to survive. Being alone and to survive so that you can also help others.
Exactly.
Multiplying yourself, no? By not be lazy, perhaps, and preserve some values that no one is an island, no? So, hindi tayo pwedeng ikaw lang magtrabaho sa sarili mo, but kailangan tayo magtulungan at siya din ay tutulong sa sarili niya. So, in other nga, you produce, everybody must produce their own initiatives,
Yes.
their inherent powers to survive and be able to help others.
Yeah. And that is all about living life in beautiful abundance, Doc.
Yes.
Diba? Doc, pag-usapan naman natin ang Heal Philippines Party List or Heal PH Party
Heal
List.
PH.
You are one of the key figures, diba, behind the Heal PH Party
Excuse me.
List. So can you tell us more about the mission and what you hope to achieve?
Well, our party list, the Heal Philippines, no, is practically motivated by some key. The motivation actually was showered by our principal. No, sabi ko nga, it's always the problem of how we can improve healthcare system. No,
Okay.
it has been a chronic, systematic issues for years and years. Even I was still a younger doctor. Na bakit kulang lahat, no? Kulang yung insufficient budget or fund, insufficient allocation of budgets, or insufficient infrastructure that hinders the delivery of healthcare. So, may kulang lagi.
Yes.
So, tingin ko, natingnan namin na siguro, hindi naman kami siguro Superman, but being almost all the members are doctors, and with that advocacy of introducing reforms that maybe some other parties were not able to deliver, kaya nagkaroon kami ng samahan na gano'n. So, yun nga, especially yung mga problem ng access, no? Sinabi ko kanina, lack of funding, infrastructure, etc. These are all the reason why people has the lack of access to healthcare. Kulang lahat. So, ang aming party is trying to provide an option or a dream about that all Filipinos must have an equal and decent access to healthcare. Pobre ka man, mayaman ka man, dapat pare-pareho kayo at meron kayong the same.
Yes. How do you relate it with the mission and vision of PhilHealth, of having this so-called universal coverage?
The universal health coverage is like almost our vision, no?
Yes.
So, hindi nilang nabibigyan ng proper, focus in terms of budget, no? So, yun ang nire-recommend namin na a very ambitious thing, no? Ambitious advocacy na lahat ng Pilipino magkaroon ng access nga through a card, no?
Yes.
We call it a health card.
Yan,
No?
yan yun, Doc.
No.
Health card
Para,
para sa lahat.
it will minimize the, marami mga bureaucracy. Like now, we have a lot of support. We have different support. Like we have MAIP, the government support. We have Malasakit. We have the other local government health fund, no? And we saw it that if all this money will be pulled into one, at maibigay sa isang competent agency or mechanism or system na pwede natin gamitin, perhaps we can cover the entire needs of our Filipino, perhaps, no?
So, Doc, what is this health card all about?
Yes, it is like, the dream of our universal healthcare, no?
Yeah.
All Filipinos must have free access to all health facilities. So ngayon, para bang hindi pa materialize dahil nga yung kulang ng budget. No? And as a group, or the party list, the Health Philippines, will try to magnify, amplify the ambition of the universal healthcare.
Okay.
I say magnify or amplify. Kasi yan ang intention ng universal healthcare. So, this is a very ambitious advocacy of ours. But sabi ko, it's mas mabuti ito kaysa wala tayong paliginip Mabuti pa nga.
Yeah.
So, sabi ko nga, if the resources will just be put together, maybe we can achieve na magkakaroon ng ganitong sistema na ang health card, which is our advocacy, that we will offer it to all Filipinos, that they can be given equitable treatment of their health needs. Pero basically, if it can be achieved, so the access will be there available. No? Kasi yan ating problema, the access, how access can be improved. That will be more available. Any facilities, whether you're in a private sector or in government, more importantly, the gobyerno. No?
Okay. Every Filipino, sabi mo nga, every Filipino has access to this. Of this member, to be a member of this health card or to have this card, meron ba tayong ganon? Meron ba siyang sinasabi natin?
Meron tayong mga sabi ko nga, this is a very...
Which is our priority is the poorest of the poor.
We were
right?
biased to the poor, no? And ang middle class lang nagiging poor na So, basically, ang ating health expenditure, katulad ng health expenditure natin, that includes the paying capacity, paying population. Last year, so about 1.3 trillion.
Okay.
And out of that, half of that is out of pocket, the 500 million. The remaining are represented by the formal sectors who pays PhilHealth, and private and government also pay share of their PhilHealth. Our government is also subsidizing our poorest of the poor, and at the same time our PWD and our senior citizens. All of this amount represents the 1.3 trillion. At marami pa rin tayo nag-out of pocket na 500 million. So, yun ang taming ina-address.
Yes.
How can we minimize that?
Out of the pocket.
Out of
Actually,
pocket.
in fact, yun din talaga ang gustong mangyari ng PhilHealth before. And I am very happy no, na merong mga institution or merong like this which really, kumbaga, alam nyo pala, Doc, no? Alam nyo na ito yung problema ng ating bansa. And you're trying to address this problem. Diba? So, yun yung pinaka-importante. Doc, kumbaga, it's really inspiring. The vision and the advocacy in championing better healthcare for Filipinos. It's clear that your passion for healing goes beyond operating room. You are now going outside your box. You are now going the entire Philippines. And that is really something. And I want to thank you for sharing that wisdom and experiences with us. But now, we have to switch things, no? Mag-rest muna tayo for a while and
Okay.
mag-game muna tayo. We're going to play a quick game called Fast Talk.
Okay.
So I will throw you some quick questions and all you have to do is what comes first in your mind,
Okay.
eto yung sagot mo.
Okay.
Okay? Game ka na ba?
Game na.
Okay, thank you. Sir, surgery or public health?
Combine.
Combined. Coffee or tea?
I would like tea,
Kung hindi ka doktor, ano ka ngayon?
pilot.
God. Heal the body or heal the mind?
Of course, the mind is important to me.
Oh, not the body.
It follows.
It follows. Okay. So, one thing you always have in your bag, anong meron? Parang wala akong nakitang bag pagpasok mo. Cellphone lang. Nandun lahat sa cellphone mo yata
Well,
ang
when we
sekreto
were
mo.
students, we were so, I don't know, during the time, my bag is always full of, cellphone now.
Sikreto sa pagiging macho.
Yes. Well,
I want to know.
Being healthy is
Okay.
important to everybody, the mind over your body. So you keep a good balanced diet, exercise.
Doc, one health tip for everyone that we should follow.
Always maintain your values. If you have some values, keep it that way.
Okay.
Be consistent.
Yes, I like that. Not just working hard, but you're also working smart. What's your dream for the future of Philippine healthcare?
Specifically, if I talk about PhilHealth, napakabigat ata yan eh. But kung i-advise ko sa mga doctors ko, I would say that while navigating their daily medical practice, dapat sa isip nila, forefront in their minds, are they keeping the patient, think of the patient always. Because their voice, their expertise,
Yes.
their commitment is basically it will help reinforce strengthening the healthcare system of the Philippines. Kailangan isipin nila yun. So other than that, reinforcing the intention of the government to provide better care because that is the rights of everybody, the basic human rights, an obligation of the states, is to be consistent with the programs of the delivery of this intention. Kasi ang palagay ko ngayon is nagtitingin ko, isa fragmented tayo eh. Tagal na ako sa gobyerno, pero nakikita ko, isa fragmented issue. So, merong isang ganito, merong isang ganito, merong isang ganito. Sinabi ko nga kanina sa'yo, if we can only consolidate all our forces and work as one, sabi ganon, maybe we can achieve. Kasi nagiging highly politicalized ang ating health ngayon. To be honest with you, that is one of my frustrations. Dapat may mga linkages tayo eh. So when we have linkages, our linkages overlap each other.
Yes.
Military, religious, politics, whatever you call it, we have linkages. But when it overlaps the linkages, yan nagkakaproblema tayo.
I know that you have the heart, Alam mo yung seryoso ka sa advocacy mo to really fulfill, sabi mo nga kanina, napakahirap. You have to magnify, you have to amplify everything, right?
That's why we're joining politics, because we hope that you can amplify the policies that has been stagnant there, that has been always a promise. And we hope that we doctors, we came up basically lahat ng some members are galing sa DOS yan eh. Undersecretaries,
Yes.
assistant secretaries. Now, hopefully that we can make a policy that will be consistent and also influence other policymakers to our direction. Kasi itong aming advocacy, napakahirap ito eh. So, sabi ko, dapat embrace pa kami ng mga tao
Exactly.
with the same direction.
Finally, what's your legacy? No, legacy to you hope to live behind
My legacy.
for the healthcare industry and of course for the Filipino people.
We are not just doctors. We must also be leaders and advocates and agents to change.
Okay,
Diba?
I love that. Agent to change.
So in that way, sabi ko, we can be a part of the progress because we ventilate. We don't keep in one corner of our clinic. Sabi ko nga, dapat tumabas ka. Be out of the box and be a part of what is going on. Sabi ko, let's continue to contribute to the nation at what we can offer and work together. No? Nakikita ko nga yun eh. So, huwag tayo magbahal dahil because I'm a doctor, I don't care about what's happening outside. And sabi ko, be involved in any form of responsibility. Just don't stick it out as being a doctor. You have also a responsibility to be like a leader to more or less help and cure other things, other being having surgery or having to treat myocardial infarction. You have an obligation to the society.
Yes.
Yan po.
Thank you very much, Doc. Sabi ko nga, being a doctor is not just a profession, but it's a vocation. So, Doc, it has been such an honor having you here today. Our dedication, your dedication, of course, to healthcare and your inspiring journey reminds us all that true success is found in service to others. Thank you for sharing your story and wisdom with us. And before we finally end this, Doc, we have a little token of appreciation for you. This is my brand, my Beautiful Abundance perfume. I hope you will like it. Thank you very much, Doki. Of course, your final words to our people about the PH party list.
I thank you. Thank you for this time. I'm not used to this kind of engagement, but anyway, I would like to appeal to everybody that our party list, Heal Philippines, is something that can offer some different. We are offering 3 advocacies. That, as I said, we have an unlimited health card that can offer to all. A very ambitious endeavor, but we will do it with the help of others. No? We're also advocating to improve all our health facilities that requires support in terms of the infrastructure, modernizing so that more access can be given to our patients. Marami pa rin hindi naaabot ng ating mga health workers or our health agencies, malalayo pa. Lately, I just talked to some guys during my little discussion na marami pa rin na hindi naaabot ng ating mga health workers that requires to reduce the gap of our health today. Marami pa. At salamat at thank you then for the
Thank you very much, sir. Thank you very much, Doc. And once again, thank you very much, Doc Romy, and to everyone watching. I hope you were inspired of today's conversation. If you enjoyed this episode, don't forget to like, follow, and subscribe to stay updated on more inspiring stories of wealth, wellness, and living life in beautiful abundance. See you next time!